Knowing how to give an intramuscular injection safely is crucial. This knowledge is important for healthcare providers and individuals administering medication at home. Intramuscular injections deliver medication directly into the muscle. This allows for fast and effective absorption. It's important to follow proper techniques for safety and comfort. This guide will provide a step-by-step approach to administering intramuscular injections safely and effectively. We will cover everything from gathering supplies to minimizing pain and ensuring sterility. Whether you are a healthcare professional or a caregiver at home, understanding the intricacies of this procedure is paramount. Remember, safety and hygiene are paramount when administering any injection. Before you begin, gather all the necessary supplies. Having everything ready ensures a smooth and efficient process. First, you'll need the medication vial itself. Ensure the medication is prescribed by a doctor and the vial is intact. Next, you will need an alcohol prep pad for disinfecting the injection site. You'll also need a clean syringe and the appropriate size needle. Choose the needle size based on the patient's size and the injection site. Finally, have a sharps container nearby for safe disposal of the used needle. Never reuse needles. With your supplies ready, you can now prepare the injection. Make sure you have all the necessary items within reach to ensure a smooth process. Wash your hands thoroughly with soap and water. This step is essential to maintain a sterile environment and prevent any potential contamination. This is crucial to prevent infection. Spend at least 20 seconds scrubbing all parts of your hands, including between your fingers and under your nails. Next, put on clean gloves before handling any of the supplies. Gloves provide an additional layer of protection against germs and bacteria. Remove the cap from the medication vial and clean the rubber top with an alcohol prep pad. This ensures that the vial is free from any contaminants. Then draw air into the syringe. The amount of air should be equal to the dose of medication you will be administering. The amount of air should be equal to the dose of medication you will be administering. This step helps in creating the right pressure inside the vial. Inject the air into the medication vial. This creates pressure and makes it easier to withdraw the medication. This creates pressure and makes it easier to withdraw the medication. Ensure the needle remains in the vial as you proceed to the next step. Keep the needle in the vial and draw back the plunger to withdraw the correct dosage. Double-check the amount to ensure accuracy before proceeding. Section 4. Administering the injection, a smooth and safe technique. This section will guide you through the steps to ensure a smooth and safe injection process. Now, you are ready to administer the injection. Make sure you have all the necessary supplies within reach, including the syringe, needle, alcohol prep pad, and the medication. Choose the right injection site. This is crucial for the effectiveness and comfort of the injection. Common sites include the deltoid muscle in the upper arm, which is often used for vaccinations. The vastus lateralis muscle in the thigh is another option, especially for larger volumes of medication. And the ventrogluteal muscle in the hip is preferred for its low risk of nerve damage. Once you have selected the site, clean the area thoroughly with an alcohol prep pad. This step is essential to prevent infection. Let the area air dry completely. This ensures that the alcohol has enough time to kill any bacteria on the skin. Hold the syringe like a dart and insert the needle into the muscle at a 90-degree angle. This technique helps to minimize pain and ensures the medication is delivered into the muscle. Aspirate by pulling back slightly on the plunger. This step checks for blood, indicating if the needle has entered a blood vessel. If you see blood, withdraw the needle and choose a different site. This prevents injecting medication directly into the bloodstream. If there is no blood, slowly inject the medication. Take your time to ensure the medication is administered smoothly and comfortably for the patient. Section 5. Conclusion, safety and cleanliness are paramount. In any medical procedure, ensuring the highest standards of safety and cleanliness is crucial. This is especially true when administering intramuscular injections. After injecting the medication, gently withdraw the needle and immediately dispose of it in a sharps container. This step is vital to prevent any accidental needle sticks and to maintain a sterile environment. Never recap a used needle. Recapping can lead to accidental needle sticks, which can be dangerous and lead to infections. Apply gentle pressure to the injection site with a clean gauze pad. This helps to stop any bleeding and ensures that the medication is properly absorbed. This helps to stop any bleeding. Keeping the site clean and applying pressure can also reduce the risk of infection. Remember that giving an intramuscular injection requires careful attention to detail. Proper technique is essential to ensure the medication is delivered effectively and safely. Always follow proper hygiene practices and use sterile techniques. This includes washing your hands thoroughly and wearing sterile gloves to prevent contamination. If you are unsure about any step of the process, consult with a healthcare professional. They can provide valuable insights and ensure that you are following the correct procedures. They can provide guidance and answer any questions you may have. It's always better to ask and be sure than to risk making a mistake. By following these steps, you can help ensure the safe and effective administration of intramuscular injections. Proper technique, hygiene, and attention to detail are key to successful outcomes.